Hi, welcome to the Body Shop Physical Therapy. I'm going to go over trigger point release of the Quadratus Lumborum muscle. This muscle is usually a problem when there is low back pain and it can be overlooked. So if you're having low back pain, you want to make sure that the Quadratus Lumborum is one of the muscles that is addressed in the low back. It can refer pain down into the buttocks region and can be a culprit if you stand or sit for long periods because it is a postural muscle. Hi, I am Dr. Price and I am a physical therapist. I want to share with you a common muscle that I find problems with when there is the presence of low back pain. It is called the quadratus lumborum muscle and it is attached in the low back from the 12th rib, so the very bottom of the thoracic spine. It attaches to the transverse processes, so those bony parts of the vertebrae in the spine from L1 through L4. Most low back problems are found between L4 and L5 and L5 and S1. And it is going to hold your body upright. It's going to hike the hip up. So it'll be responsible for hiking a hip if you are walking and just lifting the leg. It's going to hold the trunk up so it extends your body backwards. But if there's a leg length difference or there's an imbalance in the pelvis, then one side is usually more contracted than the other. And the contracted side is usually the side that's going to be most problematic. So it's a muscle that works all of the time. So if the core has weakness, then you'll find problems in that quadratus lumborum muscle. So to show you the attachment points, if you go to the bottom of your ribs, you'll find there are two floating ribs, and the one that is the longest that comes around to the side, that's your 11th rib. And then the 12th rib is short, so you can follow that in close to the spine, and there's going to be an extension, a bony extension, and that's going to be my 12th rib. So that's where it attaches to. And then it's going to attach into the transverse processes right in my lumbar spine and into my iliac crest on the back side. So right here on the top part of your bony area of your hip. So that muscle is going to span this area of the back right here. To address trigger points, we want to apply pressure. The best tool that I find to address the quadratus lumborum is using a golf ball. So to release the quadratus lumborum, you're first going to find that 12th rib. So you can find the 11th, the floating rib, the longest one in the front side of your body. Then the 12th, you're going to drop down, wrap around close to your spine, and you'll run right into that bony prominence that sticks out. That's your 12th rib. Take your golf ball. You're going to apply it right at the edge of that 12th rib. Ribs are like willow branches. They are bendy. They are going to bend and fold when you apply pressure to the rib. So I'm going to just put pressure at the attachment point there. You can come down lower. There's 3 different portions of the quadratus lumborum, so you can find tender areas in that muscle throughout that lower part of your back. But I like to start with the release right at the 12th rib. So I'm going to find my 12th rib, apply the golf ball to that region, and then what you want to do is you want to lie on a firm surface. And when you lie down, the side that you're releasing, you can cross your leg over and you should still feel pressure down into the golf ball. So that is going to be the release of the trigger point in the quadratus lumborum. And what I like to do is bring my knee up to my chest and rotate my body over to the side, and that further allows me to apply pressure into the quadratus lumborum. I want to spend 2 minutes releasing this muscle, so I'm going to just hang out on the golf ball, applying where there's most tension or tenderness. So I will move the golf ball where I need to, and then I'm going to use that leg, bringing it up to my chest, and then rocking over to the side. And then I can also bring my leg into a figure four position, and I should feel pressure down into that muscle. And it will be tender and it will have tension, and you'll find it if there are problem areas there. So spend 2 minutes on the release for the quadratus lumborum, and then you want to stretch it to restore the muscle tendon length relationship. To stretch that quadratus lumborum, what you want to do, so if I release the right side, if I want to stretch the right side, I'm going to bring my arms up in a Y position. So over your head, you're just going to bring your arms in a Y position. I want to stretch my right side. So I cross my left leg over my right, and then I pull my leg over to the left, and then I should get that stretch in the muscle that I just released. So this is going to be the stretch to the quadratus lumborum. I'll hold this for a minute, relax, and repeat for a third time. And this is beneficial usually if there's stenosis in the back. There can be multiple problems if you sit for long periods, stand for long periods, then the quadratus lumborum is most likely a culprit in the low back when there is pain present. So I want to release the quadratus lumborum, I want to stretch it, and then you do not need to strengthen it. It's going to be a postural muscle that's going to over contract and tend to fire frequently, but you do want to strengthen the abdominals. I find that when you increase the abdominal strength, you turn off the back muscle. And the transverse abdominals is a continuation fascial connective tissue with that muscle, but I want to work from the front to stabilize so that the back doesn't have to overwork. To do that, I want to take the quadratus lumborum out. So I'll bring my legs up. So if they're out here, sometimes we'll engage the low back, and that's not what I want. I want to take the back out of it. So I'll bring my legs in angled more to take lengthen the back. And I'm going to then be engaging the abdominals to hold my legs here. And if there's no osteoporosis, I can then grab a weight and I can do crunches forward this way. I can even just let my legs rest over a chair, work on crunches forward here, and I want to turn on the front side, the transverse abdominals, and turn off the back side. So making sure that my back is flat and I'm taking the back out of it. As soon as you lower your legs, if you have a strong core, that's okay to work the abdominals that way. But if the abdominals are weak, the back takes over. So you want to keep the legs up and you want to engage and focus on contracting the core. And you can work on abdominals this way. You can do 4 sets of 25. You can do long holds, and you want to feel that working. So it just depends on where your core strength is in what exercise and how the frequency and duration of how long to hold those. So strengthening here after the release of the quadratus lumborum can be helpful for folks that have low back pain when the back begins to hurt when sitting or standing for long periods, and can be a culprit and overlooked. So the quadratus lumborum, very common muscle involved in low back pain. Find that area, release using a tool, which I use a golf ball, and then stretch the muscle and then strengthen the abdominals. And this may help to start to alleviate that back pain that comes from the quadratus lumborum. Now, there's a whole orchestra involved. So if you've got a quadratus lumborum problem on one side, there's usually other muscles involved as well. That includes the piriformis, the glute medius, and those can be addressed as well so that you're then treating the whole group of problems that are contributing to the continuation of the low back pain. But keeping it simple, quadratus lumborum, check to see, is one side tender, is it overfiring? Release that muscle, take 2 minutes to work on the trigger points, stretch that muscle, and then strengthen your abdominals. This is a good approach to helping to alleviate that back pain. So I hope this is of help, and have a blessed day. Thank you.